It's Filler Friday, so as promised, I'm going to come on a Fridays and we're going to discuss all things filler. So on Tuesdays, we did Tox Tuesday and we spoke about lip lines or smokers lines or barcode lines as they are called now, because not everybody smokes. So some people do get the barcode lines, smokers lines, and they've never smoked all their life before. It's a loss of volume, it's the loss of collagen in the skin and elasticity, so then the skin starts to crease. As we purse the lips start to get these vertical lines down here, which can go into the lip as well. When we're using Botox, we're relaxing the contraction of muscles. So we use Botox when you only get the lines when you're pursing. So you only get the lines when you do that. When you're at rest, if you've no lines there, we can use the Botox. If the lines are there when you're not pursing your lips or doing that or contracting the muscle, then we need to use filler, because it's not the contraction that is solely responsible for those lines. It's volume loss and skin laxity, it's in collagen. So when we're using dermal fillers, so dermal fillers, we're going to be speaking specifically about hyaluronic acid fillers. There are other fillers, but we speak mostly about hyaluronic acid fillers. I only use hyaluronic acid fillers because they're the ones that we can dissolve if there is an issue. I don't use the other fillers because we can't dissolve them. They can cause things like nodules and granulomas, so I tend to stay away from anything like that. So when we're using HA filler, hyaluronic acid is a molecule that pulls in fluid. It's hydrophilic. So when we put it in places, it's going to expand. People call it migration, but really it's the filler expanding, which is what it's supposed to do. And it is for people who have volume loss, not for younger people that don't have volume loss. Obviously, if you want to plump your lips up and you're younger, then that's fine if you want bigger lips. But if you do have some volume loss, which is around the lips, and that is contributing to your lip lines, the way that I do it is just get little tiny needles and we just go in and we do little blebs all along each individual line, just with the tip of the needle. It's not pain-free because it is the most sensitive area that you can inject. So we do numb that at least 20 minutes before you can numb it. And it's better if you numb it and put some cling film on, because that is going to numb you even better. So it is quite an eye-watery thing to have done. So there's that way that we can do it. We can also do the lips. So I don't have any lines here and I don't have any filler here, but I do have lip filler. So when I purse my lips, it makes it difficult to contract because there is volume there. So it's not letting the lip squeeze as much as it would do if I took the volume out. If I took the volume out and they were flat, I would get these lines when I pursed the lips. But because I've got my lips filled, then I don't get that. So that's another way that